Hey guys, how's it going? Hector, Casey?
Good morning.
Good morning. So here in beautiful Tampa again, and going to talk today about something we've talked about before, but we're going to put a little twist on it because it is so integral to our practice. And so, I think about this question a lot, which is, Dr. Saylor, what defines your practice philosophy, right? And for years, it's like I really didn't know how to answer this question. Sometimes I hear this out of people and I'm like, duh. I mean, that's like, does that really say anything? I can tell you at this point, what I'm going to tell you really defines our practice philosophy. And it's so much more than what I'm going to say. So what I would say separates Saylor Dental, given reason to smile, from other practices would be we really do focus, hyper-focus, on getting you to 100 with all your teeth. So what I mean to say is that one statement really defines pretty much all the decisions that we make. And so when we talk with patients, from the very first exam, from a consultation to our full exam, the process is all about how do we do that? It's not easy, and you're never going to do it unless there's an intention on that and unless there's a system to do that. So if I can try to get into this a little bit and unpack that statement, what it means is we're always trying to dial that in, okay? So you've heard me talk about the A, B's, and C's. The A's are really getting you out of survival mode, right? So when I say there are things that need to be done like yesterday, I really mean that. We have no hopes of getting you to 100 with all your teeth until the A's are done, right? We get the A's done, whatever that may be. I mean, sometimes there are a lot of A's. And I will say something that sometimes I think people look at me like, well, that was rude. And I'll say, you need to beg, borrow, or steal to get these A's off your list. And yes, it is about timing, and it's difficult sometimes. You got a single mom in with 2 kids, and I may say that, and it can be received very harshly. But basically, if you're not able to get those A's done, we can't get you out of that survival mode. And it's like it's like you can do it, but you're going to pay a serious penalty if you have to do it later, right? So those things don't go away on their own. Those A's have to be off your list. But really, where you get ahead are the B's. The B's are the things that we look at and say, okay, we got your A's done. You're out of survival mode. But these B's are where we're dialing it in to kind of get you set up to thrive. And the B's are the difficult ones, right? Because why? Because the B's, you may not even know were there unless we were to actually show you. Because you don't feel the B's. The B's are not obvious. The B's are things that it takes some relationship with your dentist to know the cause and effect relationship of why it would behoove you, why it would be in your best interest to get these B's off your list. So what are the B's? The examples of B's would be these tedious, insidious things that are like recession. Doesn't hurt necessarily. You may not even know it was there until we actually, show you, and it's like, well, that doesn't hurt me. I mean, I've had that for years. My parents have that. But they're going to pay the price for it if it's not taken care of once your A's are done, right? And not all recession needs to be taken care of, but you're relying on the relationship with your dentist. And when should it be taken care of, right? And at what time? It could always be done later, but there is a cost for kicking that can down the road. Wear on teeth. That's a hard B, right? It's like somebody in their 30s or 40s would be like, yeah, but I'm 35 years old. That's normal. It's not normal. Wear on your teeth is pathologic. It is a slow leak, as I like to say. It's a slow leak. It's like, this thing is leaking, it's not sustainable, but it's easy to ignore. You're relying on your relationship with me, with my staff, on why it would be in your best interest to take care of the bees. Because all my brain is focused on is, I'm not going to get you to 100 with all your teeth if this isn't taken care of. And we're not pushers. We are your resource to help you get what you want. And if that is what you want, I mean, it's not for everybody. Some people look at me and they go, Doc, I don't want to live to 100. I'm like, you may not want to live to 100, but we need a design that will help your teeth get there, okay? And that is, it's more future focused, and it is, believe me, I see so many people that said that 30 years ago, and now they're starting to get serious about it. Like, wow, you weren't kidding, right? So what's another slow leak? Cracks in teeth. Cracks in teeth. Please don't get to the crack in the tooth when it hurts you, because our predictability goes down. If I see a crack in the tooth, I'm not going to diagnose something unless I know it's going to be in your best interest to treat. But they don't hurt, you can't see it, and you're like, we can't even see it on the x-ray. How can this be something that needs to be done? And unfortunately, your dental insurance most of the time won't even help with a crack in the tooth. And I'll look at you again and say something rude like, hey, doesn't matter if your dental insurance covers it or not. I can tell you if I've diagnosed it, it needs to be done regardless of dental insurance. We're not going to rely on your dental insurance to dictate your treatment plan. They're not there in the room. They don't have the relationship with you. And this is something that I can look you in the eye and say, it's going to be in your best interest to do this. And, there's a crack there. It's starting. I've watched it kind of propagate like a crack in the windshield. You push on it, it's going to go all the way. And let's not wait until it hurts. Another slow leak. How about missing teeth? Now it's in the back, Doc, it never shows. We see this all day long, and I understand. It's a difficult one because the energy it takes to get that tooth back, and remember, today we're talking about implants, right? We're not talking about a bridge. The energy it takes to get that tooth back, it's difficult. You got to go back in there a lot of times, build the bone, put the implant in, wait 3 months, wait another month to get the crown back in there. But basically what we're paying for is elapsed time, right? A lot of time went by, and the energy it takes to turn that clock back to when you had a tooth there, replace it, it requires about that amount of energy. So that's another B, that's a slow leak. How is that hurting you? I mean, we've gone into that before, but it is a lot of work that tooth used to take on that now the other teeth are taking on. It's a slow leak. You're not going to get to 100 with all your teeth for the most part. I mean, there are exceptions to that, right? You got the guy who smokes and made it to 100. Those are the exceptions. We're looking at, in general, we're looking at predictability, which is hard to attain. That is what we're focused on all the time. And I say hyper-focused because it is something that you'll hear me repeat again and again, because I'm going to look at your master plan and kind of remind you, okay, we've got your A's done, or if you don't have your A's done, we're going to go back to that. And now we're looking at getting ahead, as I like to say, staying 2 steps ahead. And let's get to your B's now. And, the things that can get in the way of that is, I like to say we have a real relationship, which means that I'm not always going to tell you the things that you want to hear. When I walk in for a hygiene check, what does the patient say a lot of times? Hey, Doc, don't find anything. It's not a good time. I just replaced my AC, or I just had my roof replaced. And I laugh a little bit and I say, okay, I would love to not find anything. I really would. But you really want me to mention if I do see something, even if it's a B need that I see that's about to turn an A, it's easy for me to turn the other cheek and ignore that. It would not be in your best interest for me to do so. So I can promise you, I will always tell you what's in your best interest, and then you make the decision on when it's a good time to do that, and I will reinforce it, because a lot of times patients say, well, Doc, how long can I wait on that? And that's a tough question. I will give you my best opinion, but if I say it's an A need, take it that needs to be done like yesterday. So that's a real relationship, because after all, you're coming to me not because I have such great hair or because I'm the closest to your home or because you love my staff so much, right? You're coming to me, and those things may be true, but you're coming to me, I hope, because you do want to get to 100 with all your teeth, and you know we can help you get there because we are hyper focused on that. And that would be something that could improve your quality of life and a part of your life that you feel like, I've got that part of my life taken care of. I've got that part of my life under control. It's kind of like people with their financial advisors, right? You see somebody who's like, yeah, I'm a money manager. Doc, you need to talk to me about money. I go, I think I have that part of my life taken care of. I think I feel comfortable with the person that is helping me invest my money and that I can at least beat inflation with my money in the bank, right? Or my money with that person. That is what you're relying on us to do. I think my teeth are taken care of because I see Dr. Saylor and we feel like we have a good plan that's going to get me to that end goal. And at the point where I'm in my 80s and 90s, I'm not so worried about my teeth, my hips, my knees, my whatever health situation may not be as good as I would like it to be, but my teeth are. That's one less thing you could worry about. That's one thing that you could take off your to-do list if we're able to implement the plan. So those are examples of the slow leaks, and I can go on and on and on, but the point of this is we are always thinking about getting you to 100 with all your teeth, and it does enter every part of the decision making and of the relationship we have with you, and it is going to be in your best interest, and it's not for everybody, but if that's something that you can relate to and if that's something that you think would help you, then I think you'd be very happy with taking that approach and forming a real relationship and working on your dental health. Thanks.